I'm Professor Martin Tobin from the University of Leicester. So our exhibit is about how we've set about trying to discover variations in the DNA that might predict how healthy or how unhealthy your lungs are. So there's a specific disease which is called chronic obstructive pulmonary disease, or COPD, and we know that people have varying risks of developing that disease, in part related to whether or not they smoke and how much they smoke if they're a tobacco smoker, to occupational exposures, but also genetic variation plays an important part in determining risk. But until we set about undertaking our research, we knew very little about which genetic variants might predict the risk of disease. I'm pleased to say that we have discovered a tranche of genetic variants across the human genome which are associated both with lung function in a healthy population and also with risk of developing COPD. And these are the genetic variants that this exhibit is focused on. We've bookmarked them in our printout of the entire human genome, which occupies 130 volumes and is the weight of equivalent of 6 adults at one end of our exhibit. We've put them in our Finding Genes risk puzzle that people can have a go at in the exhibit, which describes how we go about putting together patterns in DNA variation and patterns in lung capacity variation. And we put them into our risky gene machine, which is a kind of a fruit machine which people can have a play on the exhibit or online, which enables them to see how genetic variation and how whether or not you smoke predicts your risk of developing a disease, lung disease that we call COPD later in life. Passive smoking does increase the risk of certain diseases, including COPD, in a dose-response type way. So people who have been exposed to a great deal of tobacco smoke through occupations like bar work, for example, have been at higher risk of developing diseases like COPD. And that's been quite a powerful lever, really, in influencing tobacco legislation about introducing smoke-free workplaces such as bars and restaurants. It is possible that we could put some of these variants together and try to use them to predict risk of disease, but they are relatively weak predictors when compared with something like tobacco smoking, which is of course a very strong predictor of COPD. We are interested in looking in the smoking cessation clinic and whether or not providing genetic risk information could be helpful in that situation, but as of yet it's untested in that situation.